What do
Yeah,
we
yeah.
as dentists, hygienists, therapists, and nurses need to do to make sure we don't end up retiring with or due to back problems? Yeah, tell us, Ben, about posture. So, have
Yeah,
we, as
sure.
a dental industry, overplayed
Yeah.
the role of posture?
Most definitely. If there's one thing to take from this podcast, it is that.
Surely, being like this, like surely, just like you when you see those photos on people on phantom head courses, and they're like this, and they're like polishing something, and they're like that. I mean, granted, you won't be probably not like that for longer than a couple of minutes at a time. You know, when you're doing the distolingual of a 6 or a 7,
Yeah,
and
yeah.
you just have to do it. I think after listening to today and listening to you guys, I'm gonna feel less guilty about doing that, and I'm just gonna just move a lot more afterwards.
Hi guys, it's Jazz again. I want to ask you a question. How much money do we spend as a profession on our practices, on our chairs, on the service and maintenance of our equipment, on scanners, handpieces, and generally just making sure that we have our favorite kit available? What is the most valuable piece of equipment, or maybe not equipment, but most valuable asset in your practice? It is your health, your hands, your mental health, your physical health. And of course, when you consider that 94% of dentists will retire with backache, and apparently 100% of nurses will retire with backache, it makes you really wonder about our priorities. Do we actually look after our health as much as we should be? And combine that with a stressful position, with a sort of confined environment and the different postures that we have to adapt. Now, I mentioned postures, but one of the most profound things about this podcast episode is that I learned that actually the posture is really overrated in dentistry. I could not believe it. You'll hear my reactions through the podcast. This podcast episode is done with 2 physiotherapists, Sam and Ben. Sam is actually a physiotherapist-turned-dentist, so he can give us the view from sort of both sides of the profession, physio and dentistry. So this is quite a unique episode, if you like. I picked up quite a few nuggets about my own personal health. The protrusive dental pearl I want to give you today is a reading list. Ben actually shared one of his favorite books in the episode, and the book is called Why We Sleep. And so that got me thinking, and I had a few messages from people asking about my reading list after I'd mentioned those Brian Tracy books on a few episodes ago. So basically, I've put together a little book list. You can find that on the website, protrusive.co.uk/books. And you can access that. I'm going to stick it on the Protrusive Dental Community Facebook group as well. So I'm going to just, my basic recommended books that I've read. Very much a disclaimer is that the books that I put on there are very much my own taste. And the kind of books I'm into is self-help, self-development, productivity, social sciences, things like Malcolm Gladwell, for example. So those kind of books I'm into. Also personal finance. I've got 2 personal finance books on there as well, which is, what a time during COVID to consider reading into something like that. How to actually learn about looking after your personal finances, something I've taken interest in the last couple of years. I've got that on the protrusive.co.uk website /books. And we're going to jump straight to the episode, and I'll catch you in the outro.
Guys, we'll just dive right in, as I say, and we'll start the Protrusive Dental Podcast. Guys, those who are listening, I haven't met Sam, and I certainly haven't met or emailed Ben before, but we're having the first ever Protrusive 3-way.
Excellent. Wow, yeah, that's big. That's big.
So start with Sam. Sam, tell us about because we started connected by email. You've been listening to the podcast, and I think you can add some great value to the listeners today. Tell the listeners about your background in terms of your dentistry, but before your dentistry, which makes you in a position to be able to talk about the sort of things that we'll be talking about today.
Yeah, so I qualified from King's in 2015. Then I worked as a locum physiotherapist in the Northwest, and that's where I got good interest in musculoskeletal physio. Then after that, I decided that I wanted to do dentistry. So I was on the dentistry course on the 4-year program. And then while I was there, I was an associate for a private company where I saw NHS private patients. I was also the physiotherapist for Merseyside Fire and Rescue and the Philharmonic Orchestra. So lots of perks there.
Wow. Very nice.
And then, but I found that when I was working, I was seeing a lot of dentists, and I was also seeing a lot of students as well. that's what kind of got me interested in, why is dentistry such a high risk profession for, lower back pain, neck pain? And that was what the majority of it that was coming in was lower back, neck pain, upper back pain. And I also found that when I was going on placements as well, I'd ask, the principals, why do you work, why do you only work 4 days a week, or why do you work reduced hours? And most of them would say, oh, it's because of my back pain, or it's because of my neck pain. So it does have quite large impacts on dentist life, I've found.
Absolutely. And when you said, so you qualified 2015, that was not in dentistry though, right? Or was it?
That was in physiotherapy. So then I qualified dentistry last year.
Amazing. And then when you were doing your locum, that was a locum physiotherapist, right?
That was locum physiotherapy, yeah.
I was about to say, you're on this accelerated 4-year program. You're able to practice dentistry as a student. So that Sam definitely was not doing that. If anyone's listening of that sort of nature, but no, that's pretty interesting story. And now you've developed an interest in that, obviously, because of your very unique background, I think. Do you know anyone else who's had a physio/dental background like yourself?
Well, I was speaking to Ben about this just before, but I actually know, well, it was a physiotherapist that had gone on to do dentistry that helped me get into dentistry. In terms of
also at King's?
Also at King's, yeah.
Cool. Very good.
So
It's good to have that 4-year program, actually, which helps, I think, just to shorten the 5-year degree. Ben, tell us about yourself. Your background, I believe, is in musculoskeletal pain.
Yeah, absolutely. I mean, well, before I introduce myself, Jazz, I just want to say huge thanks for having me on the podcast, really. Also, I really appreciate what you're doing for dentists here. I think it's really important us clinicians, whether it's dentists, physios, doctors, it's really important that we stay current, that we stay evidence-based, and that we're learning all the time. So, kudos to you for putting this on, really. I must say that, I probably wouldn't be the clinician I am today without podcasts. I mean, shout out to the physio podcasts out there. So there's Choose Health, there's a NAF Physio podcast, there's Physio Edge, there's Strength Physio, and honestly, without their input, I wouldn't be the clinician I am today, certainly. So
I actually listened to one of the physio podcasts, Sam. I think it was Physio Edge, right? You sent me an episode for.
Yeah. Was it with David Pope?
I think it was.
Yeah.
Sam,
honestly, if I was a patient, I would want David Pope to be my physio. He just sounds like the nicest man, but you'd want to tell him about your pain. You'd want to, and he's got this really soft Australian accent. And as I say, if I could pick a physio, it'd be him every day.
It was a very good and smooth listen, and it was great to open my eyes to that world, So tell us about how do you two know each other?
So we qualified from King's together. So we went right the way through physio school, in a sense, and then we've just kept in contact ever since. So
yeah. So I didn't even introduce myself, did I? Let's go back to that bit. Sorry, mate, I went off track. I'm Ben. I'm a physio. Been working in the NHS for a number of years. Currently, my role, I see a lot of GP referrals. So if you go to your GP with neck, back, shoulder, knee pain, you probably see someone like me. I'm doing work in pain management at the moment, which is slightly like a more specialist area. So essentially, it's for patients that have had pain for longer than 6 months. And so it's become a little bit more ongoing, a bit more persistent, and the goal isn't necessarily to reduce their pain, but in fact to be more functional and live better with it. So it's not just exercise, it's stuff like sleep, stress, diet, medications, doing a setback plan, thoughts, feelings, emotions. So it involves a bit of psychology training as well. So that's kind of my current area of work, and I think that's probably why Sam reached out to me, because as I say, and what Sam said, dental practitioners seem to be a high risk group.
Yeah, I mean, I heard something like 94% of dentists. I don't know where I got this figure from. You know how they say 66% of all figures are made up? It could be one of those, but 94% of dentists will retire with back problems. and
Right.
100% of nurses apparently will retire.
100%.
Yeah, apparently so. I don't know where I got this from, but
Sure.
tell us, how prevalent is it for both of you? And we'll just dive right in terms of making it valuable for the listener. What do we as dentists, hygienists, therapists, and nurses need to do to make sure we don't end up retiring with or due to back problems?
Go on, Sam, I'll let you lead on that.
Yeah, so the prevalence is, it's 60 to 94% of dentists will experience some
see, 94.
There you go. There he is.
That's it. They'll experience some sort of musculoskeletal pain at some point in their life. That's from a systematic review, that one. And then, well, the prevalence of lower back pain in particular is massive. It's the leading cause of long-term disability. 7% of GP consultations as well are from lower back pain. For dentists, lower back pain is the most common. Then it's the neck, and then shoulders. In terms of what causes it, I think whenever I speak to dentists, if you say, "Oh, I've got low back pain," they'll instantly say, "What's your posture like? How do you sit? Do you use loops?" And if you spoke to a physiotherapist with exactly the same thing, they'd be saying, "How much exercise are you doing? Are you moving around a lot?" And it goes from almost like 1985, physiotherapists were changing people's postures and making sure they were sitting right. Whereas now, and the most current things are just to keep you moving. So I think the reason why I've got Ben on here as well is because whenever I have any physio questions, Ben's the man. And
thank you, mate. Appreciate that.
Yeah, I like his, one of the best things that Ben ever taught me or led me to was the best posture is the next posture. And that.
Okay, tell me about that. I don't get it. The best spot. Oh, as in get you moving. I like that. Yeah,
exactly. So if you're in one position for a long period of time, then you're going to get pain regardless if it's that, bolt upright, elbows at 90 degrees with loops on. If you're in that position for a long period of time, eventually you'll get pain.
So what you're saying there is, even though we're using magnification, which is keeping our head away, the problem is not necessarily the posture. The problem, are you trying to say, is that the lack of movement?
Yeah, exactly. I mean, there was a systematic review, very recent one, that looked at saddle chairs and loops, and they all agreed that loops could improve your posture, that it would improve your dentistry, you get better crown preps and things. But they never, not once did they say it will reduce your pain, because no studies seem to look at it. And one of the reasons for that is because they never find that posture links to pain. And I think Ben's very good at talking about posture. So I'll
yeah, tell us, Ben, about posture. So have we, as a dental industry, overplayed the role of posture?
Most definitely. If there's one thing to take from this podcast, it is that.
Wow, that is, for me, I mean, I think that's going to send shockwaves, I think, amongst anyone who's listening to this. That's crazy to think that.
I'm probably going to upset a lot of loop and scope companies with this, and I am aware of that. But yeah, essentially, if you'd asked a physio maybe 30 years ago, how important is posture, they'd probably say, this much. Now we're thinking it's probably this, if that. I mean, there was a paper came out 2011. It was 8 systematic reviews, and there wasn't an association, a link with posture and back pain. So, and that's with awkward postures, manual handling, prolonged sitting. All those things are just simply not linked with back pain. So it's because back pain is essentially a medically unexplained symptom. It's, you can have all the scans under the sun and it's going to show some change there, but we've got absolutely no idea what is actually causing it. It's going to be multifactorial, and it's going to be individual. A lot of what we understand about pain now isn't that it's about the tissues. It's about It's about the nervous system. We interpret the feedback from our tissues, and if our nervous system is heightened somehow, which includes our brain, etc., then it's going to be super sensitive to stimulus. So if you're in an awkward posture at work, say you've got a really busy clinic, you might be running 15 minutes late. I'm aware that I was going to swear then, but if you mess it up, I'm not sure if I'm allowed to swear, so I caught myself. But
on Apple podcast, I put myself as explicit, so it's fine.
Oh, sweet! Yay! Good stuff. All right, I'm off the hook. But yeah, so essentially, I'm aware that if you guys mess it up, you've got litigation and stuff. So that's obviously present. So it's almost, you've got a couple of things there that are kind of risk factors, stuff like stress.
So the fact that the stress is heightened in our profession. It's fast paced. So that's messing with our sort of the neuroscience part, which I think I appreciate it. It changes your, perhaps it changes what in dentistry we have something called adaptive capacity. Is that something that's relevant in physio as well?
Mate, 100%, you've nailed it there. So when pain's been going on for longer than 6 months, it's not about the tissue, it's about the nervous system. And so if you've had pain for like longer than 6 months, your nervous system, it's neuroplasticity. So synaptogenesis, stuff like increased transmitters, you have more neurons. It's a bit like if you have an amateur violinist, their cortical mapping in their brain is going to be, for their hands, is going to be fairly small. But if you get an expert violinist, the cortical mapping is going to be huge, right? If you remember, I'm not sure if you guys go through like the homunculus in the brain and stuff like that in your training, but the mapping is a lot more. So your nervous system changes to stimulus. So that the same thing happens with pain. Once you've had it for a long period of time, it's not about the tissue, it's about the nervous system, and that's how we kind of want to target back pain. It's not postural, it's not tissue focused as such. It's more about looking after yourself, sleeping well, doing some form of exercise that you enjoy, eating well, not worrying about things, especially about posture. And I suppose I've listened to a couple of your podcasts, Jazz, and as I say, I think I like how you look for the dental pearls, the bits of wisdom to take away.
Yep.
Unfortunately, I can't really give you like a big answer in terms of like a quick hack, but it simply is just looking after yourself, mate, really.
That's fantastic. I mean, Sam, you probably listened to more episodes than what Ben has, in being obviously a dentist now. Can you see the similarities in terms of what Ben's saying and what Barry Glassman says in terms of the role of occlusion and parafunction? Because everything you're saying is very, very much echoed by what Barry Glassman, Ben, if you don't know, is an oral facial pain specialist, right?
Was he the one that spoke about bruxism on your communication in bruxism? Was it that
was episode 11, but he's also of the similar camp. They prescribe the similar appliances, these anterior appliances, but what Barry Glassman also says that it's very similar to what you guys are saying. So you guys say, okay, no, it's not posture, it's and you also mentioned about neuroplasticity, but in Barry and his sort of philosophy, which I very much agree with it's not the bite. It's not the fact that the bite's messed up. It's the fact that we're parafunctioning. It's our muscles, contracting purposelessly. That leads to all the tissue damage, and then also that pain becomes chronic, and then that changes the neuroplasticity. It was him who introduced me to that term, neuroplasticity, a few years ago. So I'm just drawing these parallels from what you're saying, and I'm always apologetic but yet not sorry at the same time to bring it always back to occlusion, which is one of my favorite things to talk about, but it's true. Sam, what do you think about that?
I think that's really similar to TMJ pain and how you treat that, and especially with bruxists, because you've always got to take, yes, you have the physical symptoms of bruxism, which is the tooth damage and wear, but then you've also got the psychological factors of, you know, they're not getting enough sleep at night, or they've got children that it's really hard to look after, or social problems where they're having problems at work, or they haven't gotten, you know, access to hobbies that they used to like to do and things, and just building on the stress. So I think really the main thing is, you know, in terms of from that, but also linking it to back pain, is that if you are feeling back pain, is it because, you know, don't always think, oh, it's because of my posture, or it's because of some sort of physical entity. Think about the social things that are going on in your life, you know, whether, you know, you're having lots of family problems, your girlfriend's broken up with you, and then, like Ben was saying before, you know, if you're running late and things like that, you know, all those things will impact on your back pain. And I think like the psychological and the social factors are probably, you know, probably the reason why you're getting the back pain, rather than, you'll always find that the back pain will be the worst when, say, you know, you're running, you know, half an hour late and then your crown's not fit, or you've got a screaming child in the chair that won't take the fluoride varnish.
That's so interesting.
Yeah.
But also it's you kind of almost separating mind and body there, in the sense of like you call it dualism, don't you, where, you know, the tissues are here and the psychosocial is over here, but, you know, at the end of the day, we're treating a person here, you know, they're one and the same. If you're having pain, you're gonna probably be a bit irritable with your partner, you're gonna be a little bit more stressed than normal. Pain is quite complex like that, you know, it kind of permeates into all facets of our lives, so kind of unknowingly, well knowingly, but yeah, so part of,
has a much more profound effect than at the surface level.
100%. And patients tell me all the time, you know, it's really frustrating because it's invisible, because you can't see it, you know. So on the surface I look like I'm fine, but actually you know, the secondary suffering as a result of this pain is quite profound. So yeah, that's part of my role, is talking about how can people be more functional and live better with it. You know, okay, the pain's there, it's pissing them, sorry, I'm going to swear, it's pissing them off, and it's permeating the facets of their life, but can they control stuff like sleep? Can they manage their stress? Can they get a little bit more active? Can we give them a plan for when they do have a setback of their pain? So it's a fairly holistic and comprehensive approach to their management, really, rather than just a tissue.
Mm-hmm. Well, both of you, if you can just cover a couple of scenarios, then, is that dentist or hygienist or nurse who has not started, maybe because they're early in their career, started to show signs of back problems, what advice can you give preventatively? And then maybe a few minutes later, you can then give some advice to those who are now suffering, you know, dentists, nurses, therapists who are now suffering with pain. Is your advice essentially the same for both of them, or can you tweak it to make it tailored to that individual under those circumstances? So please, who would like to touch on that first?
Yeah. So in terms of preventative advice, the best thing to do is to keep as active as possible. The NHS guidelines say to do 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise. And, you know, a lot of people think, oh, I've got back pain, so I need to do planks or core, but if you're running, swimming, doing any exercise that you enjoy, you're going to be improving all of those structures anyway. And a famous Aristotle quote is that excellence is not an act, it's a habit. So you have to do the exercise that you like, because that's the exercise that you'll continue to do, and then you'll keep yourself, you know, strong and enjoy a more fruitful career, or a longer career as well. And then in terms of if a hygienist or a dentist were to get in pain, I think Ben's probably the best for for this.
Yeah, that's a good way. So, Sam, you've covered prevention, some tips about prevention, doing exercise, and the importance of that. So Ben, now we have the dentist, hygienist, therapist, or whoever who is now suffering with lower back pain, and they think, oh yeah, it's because I'm a dentist. I'm like this all day long. They might then buy a microscope for their practice, and they might still say, actually, no, I'm still suffering, and they might come and see someone like you. What would you do? What would you advise?
Yeah, I think. I suppose it kind of depends on the individual and how long they've had it. But I suppose it's if it's been suffering for it for a long time, I think the first thing is to get a good physio. There's a lot of kind of non evidence based kind of care out there, and you want to be seeing a physio that is evidence based, is current. There's a movement in the MSK profession at the moment called MSK Reform and the big R's, and essentially we're trying to lobby like government and our governing body to improve the standard of practice and to get us better regulated. But yeah, seeing a really good physio, because it's really difficult to do on your own. Pain is a tough thing to manage, and it's a tough old beast. So getting a good physio would probably be a good start. But I think with back pain, neck pain, etc., that it's doing some form of movement, and that's going to be quite scary because when you're in pain, you should rest, right? No, it's actually the flip side. You need to move more, and you're not going to be making your back pain any worse by moving with pain, as long as you can tolerate it. Pain doesn't always mean damage. A good example is, I'll get my examples out here, but a hangnail, paper cut, stubbing your toe, treading on a Lego. All these things are super duper painful. How much damage is there?
It's not proportional to the pain, yeah.
It's not. It's a very unreliable message of tissue damage, and people around you will say, no, you shouldn't be doing that because you're pain, but actually you should be, because that's going to desensitize your nervous system. It's going to give you the confidence to move more, which is going to help your condition. So yeah, pain doesn't always mean damage. And find the level of activity that you can do, that you can tolerate, and slowly build it up over a period of time.
Is Pilates supposed to be a good one? Pilates?
It's a very popular one. The reason it's popular is it's quite low level and it's very social. So, I mean, you could do that in any class, really. Essentially, a paper came out in like the 80s that it suggested a link between core stability and back pain. And physios at the time went absolutely bananas about it. And that's why today you see so many Pilates classes. Since it was only one paper, so since it has been debunked, and it's also like Sam was saying, it's just important to do any form of exercise, no matter what it is: Pilates, swimming, running classes, yoga, whatever, really. So yeah, it's important to kind of realize that Pilates. I mean, I'm not poo-pooing Pilates at all. I think it's a really good start, because I mean, I've done Pilates classes and they're bloody hard work, to be honest, probably because my core was awful. But yeah, it's not the be all and end all, is what I'm saying. And it's a great start to get people moving. And plus, with a class, it's social. Do you know what I mean? And we're social animals at the end of the day. And if you haven't exercised before, I would say find something, as Sam was saying, that you like, that's social and is led by a professional, because they're going to be on it. Yeah, do this, do that, and after a couple of weeks, you're going to be seeing the same faces, and you're going to be chatting to your classmates. And as I say, we're social animals, so then you're not doing it on your own. Yeah. No, another initiative is parkrun. I love parkrun at the moment. Get to your local park and run for free in the community. What a great idea.
Brilliant. So what you're saying is find a good physio who is evidence-based and focused in that. And I completely agree. I used to think many years ago that everyone qualifies in any profession. When I was way younger, like in my teens, I used to think, okay, all dentists are the same, all doctors are the same, all of any profession are the same. And I still, you learn over time that actually, no, not everyone is as evidence focused. Not every, and I know some plenty. Well, let's not go into that. I'm not going to give any examples, but yeah, there's, I think you know where I was heading there, but
yeah, I do. So if I dive in with non-evidence based stuff, I think that would probably be a good shout. So stuff like manual therapy. I mean, it does have some evidence, but it's very short term. So stuff like massage. So massage is a really popular one. The way it works isn't how people think. It doesn't change your muscles at all because there's no friction, right? So when you rub the skin, you could rub it all day, every day. You're not going to change the muscles in terms of their health. But what it will do, because you're getting a massage, it's going to release the body's natural painkillers, desensitizing that nervous system for, if it's a crap massage, a couple of hours. If it's a good massage, a week, 2 weeks. So yeah, that's not going to be good for long-term management of your back or neck pain. I'd probably put mobilizations and manipulations in there as well. So that some people might have had those before, where people were treating joints, getting a click, that kind of thing. The effects of those are fairly short-term as well. So okay if you're looking for short-term relief, but not for long-term relief. And stuff about like biomechanics and getting insoles and stuff like that. The evidence for that is kind of fairly low. Acupuncture is another one, and acupuncture has been taken off the back pain guidance for the NHS, the NICE guidance, because versus placebo, it's and sham, it has equal effect. Same with ultrasound. Mm-hmm. So if your physio starts getting those kind of treatments out, you probably want to question whether they're the physio for you, basically.
That is really, really good, useful insight. Honestly, you don't get this sort of insight in terms of what's a good physio, what's not. And I think by giving that information that you did, it will help a lot of dentists who may already be seeing a physio thinking, actually, is this really working or not? Sam, can I ask you a couple of questions in terms of, obviously you're full-time dentist at the moment?
Yeah, so I'm in my foundation year at the moment. Yeah.
How you finding it? Whereabouts are you doing that?
Very good. I'm in the Wirral actually at the moment, which is just near Liverpool, as you can probably tell from my accent.
Yeah, I was in the Wirral actually this weekend. I wish I'd known. I would have invited you to do this in person. But this is probably the best coronavirus situation actually. Doing it
yeah, good job.
So that's probably good.
But even at the practice I've been at, I'd say I've given advice or even treated every single person in the practice now. I'd say. Physiotherapy, but back
pain. Yeah, well, you've got an added skill set. What I want to ask you is, as a wet-fingered dentist now, can you tell us some things that we could be doing at work? So obviously Ben's covered very nicely about physios and the role of movement. What can we do while we're at work 9 to 5 to help the cause? And also one question I really want to get in there is there any evidence that, well, probably not any evidence because it's probably never been studied, but doing checkups while you're standing up, I heard, oh yeah, that's supposed to be good. But then that's really relating to the posture theory, right? But you tell me.
So I use loops all the time, and I do find that helps. But when I'm doing my examinations and things, I'm never in one position. So at university, a lot of the time, they always tell you to sit down and to make sure, you're in a good position, you stay in that one position. But I remember, I'm going to name drop, but I remember Ian Dunn came round, and he's great. He's one of the perio guys. And he was saying, you've got to keep moving around your patient to be able to do the best dentistry. And that's really true. And that's, if you're moving around the patient, even when you're doing a checkup or anything, that's absolutely great. I'd say that to keep yourself moving rather than the nurse going to get the patient, even just walking out to go and meet your patient and bringing them back in is good. And that's also good to help build rapport with your patient, because you'd have a little bit of chit chat before you come in, and you're getting your exercise in, or a bit of, you're getting your steps on your watch. And yeah, those are the two main things that I say. In terms of the sitting to standing, if you find that sitting down when you do your dentistry is good for you, then that's what you should continue doing. If you find that standing up, you find that the pain is less, or you enjoy standing up more, then do that. To keep yourself moving, sometimes it's good to have every other patient you could stand up, because if you stand up, you end up putting more pressure on your back, whereas when you sat down, you put more pressure on your upper back. But everybody sits different, and it's really an individual approach that you have to take. This is why, in terms of posture, it's easy to prescribe posture, because there's just a one size fits all, when really it's a one size fits no one.
That's really interesting. One thing that reminded me of is that in every single practice I've ever been to, everyone's got that same poster, the BDA poster, and it tells you about all these stretches you have to do in between your patients that might help. So the role of stretching, is it overplayed, or is stretching good for preventing back pain?
I could go on that one, Sam, if that's all right. So yeah, stretching's an interesting one, actually. So there's a bit of a debate in the research in terms of what it does. We used to think it changes tissue length, right? So if you stretch, the muscle, it increases in sarcomeres in series, so you get a longer muscle. So then when you stretch, it's you get more range, basically. That's still there, but that was quite a while ago. What they're starting to learn now is it's actually to do with stretch tolerance. So your muscle doesn't really change, but actually your tolerance to that movement changes, which is why you can get changes fairly quickly. You probably might have noticed, if you stretch every day, not that I would ever do that because I'm not a fan of stretching, but if you do that every day, you get changes fairly quickly. And that's not necessarily because of changes in the tissue, which, if you go to the gym, you might get buff for 3 months ahead. But with stretching, it happens in a very short space of time, and that's because of changes in the nervous system rather than changes in the muscle. To answer your question directly, Jazz, is it important that you do those stretches? I would say, if they help you, then yes, but you're probably far better off just doing something you like outside of work.
Who has time to do all those stretches between patients as well?
Yeah, God, you guys are busy enough. You don't want to put like an extra thing on your plate, man. Don't do that.
That has been so enlightening, honestly. Like, learning about how posture is overplayed was crazy, and I actually really love how both of you have constantly, every couple of minutes, mentioned some evidence base as well. Massive respect for that.
No, fair play. I think, like I said in the at the start, like it's important we are current and evidence based. Otherwise, that's how we deliver the best care for our patients. I mean, you guys must notice it in dentistry. It changes every 5 or 10 years. So if you're not up to date, then well, the stretch example was a great example. We've kind of flipped it on its head completely there, and posture is a good example.
I'm still mind blown about posture, honestly. This is gonna. I don't know. Maybe Sam, do you think everyone's gonna be surprised listening to this, or am I just late to the party and I didn't know?
Yeah, I've given some presentations at Liverpool University to all the lecturers, and it was a shock to them. It does blow. Like, I was speaking to like some of the professors, and like even sometimes you hear, like, as I'm giving the lecture, you hear people gasp as you say that it doesn't matter, because you see everybody looking at each other as you get into it, and they're like, oh yeah, he's going to talk about how I've got to sit right. And then the next minute you say, it doesn't matter, and everybody's shocked. So, yeah.
That's really cool.
But it's interesting because there was a paper that me and Sam went through. It was they got this thing called biofeedback in English. It's where it basically shocks you to put you in a good position if you're not in a good position, and it made people's pain worse. So
wow.
In fact, there's evidence that focusing on posture too much actually makes it worse, and it makes sense, right? So if pain is perceived in the nervous system, and you're thinking about your posture all the time. You're like, you're in a position, whatever position you're in, and you're like, oh shit, I need to. So you're thinking about it, you're re-registering those messages, you're getting those neurons firing by thinking about it. So actually, you just need to change your position for symptom relief, and do all those bits I mentioned outside of work. So
Yeah.
I say the same thing to the people who overcomplicate, and my patients who think too much about their bite or think too much about the position of their tongue. You know, just relax and you know, it's the same thing. People who focus too much about their posture, people who focus too much on the position of their anatomy and their bite and stuff. I was drawing parallels in my head as you said that.
I think one of the facts that I quite like getting in is that for the last 84,000 generations of Homo sapien, we've been walking or running for 10 miles a day. For the last few generations, the average amount of walking or running is less than 1 kilometer a day. And
wow,
our genes are geared to move that amount. And then as soon as you're moving so much less, you know, you can't change your genetics. Our bodies are meant to move. So as soon as you're put in that static position, or if you're not exercising outside work, that's why you're getting these problems, because we're just not designed to be static and immobile. We're designed to move. And that's why Ben's saying all the time, you know, the thing that's going to get you better is movement. When you're in pain, you need to move. And that's because our body, that's what your bodies are screaming out for. And also, when you do get back pain, you know, a lot, you know, we were saying before that it's not due to physical injury, but a lot of the time feeling a bit of back pain is a preventative mechanism that your brain uses to tell you to move. And soon, you know, dentists will say, oh, what position should I move in? But me and Ben were speaking the other night, and we were saying that it's okay to slouch. If you find that slouching is comfortable, then perform your dentistry in a slouched position. And then you know, eventually, over time, like we said, if you're in one position for a long period of time, you're most likely going to get pain. So if you're in pain when you're slouching, then move to a different position, but don't ever be afraid to slouch, and you're fine. I mean, one of my friends, who's doing the FD, their TPD was budging them, telling them not to slouch and to sit up straight. So yeah.
Did you keep your? Did you have to bite your tongue for that one?
Well, yeah, you've got to, haven't you?
Yeah. But surely being like this, like surely just like you when you see those photos on people on phantom head courses and they're like this and they're like polishing something and they're like that. I mean, granted, you won't be probably not like that for longer than a couple of minutes at a time. You know, when you're doing the distolingual of a 6 or a 7, and you just have to do it. I think after listening to today and listening to you guys, I'm going to feel less guilty about doing that, and I'm just going to just move a lot more afterwards.
And I think we know that, you know, if you put your arm out in front of you for a small amount of time, it's not painful. But if you left it there for like, you know, a couple of minutes, it would start to get tired and painful. And that's the same with leaning over with the phantom heads. You'll only be able to physically be able to stay there for so long before you can't bear it, and you have to then change to the other side. So
you just have to listen to your body.
Yeah. I mean, we've talked a lot about movement here, and you know, I suppose that when we talk about movement, we refer to the tissues. I think if we zoom out as well, like it's important we look after ourselves. Like exercise is a component of that, but you've got to also focus on stuff like sleep. I mean, if any you guys are science geeks, so you'll definitely. I mean, I know that Sam's read it, but if you ever read Why We Sleep by Matthew Walker, it's an absolute blockbuster. Honestly, it's like the forgotten pillar of medicine, in my opinion. So yeah, getting a good night's sleeping is really, really important. You know, managing your stress, however, that's the very tough thing to do, but trying to mitigate that as best possible. Eating well, and yeah, just all those things. You might have come across Dr. Rangan Chatterjee, who was on the telly, GP at Home. He talks about the 4 pillars of medicine, which are lifestyle medicine, and that is exercise, diet, sleep, and being more relaxed and less stressed. And most people are missing 1 or 2 of those. So if whatever the low-hanging fruit is the one of those that you feel like you could probably address, because at the end of the day, with healthcare professionals and we're clinicians, and we need to look after ourselves and we can look after others. Clinician self-care is quite a big thing at the moment. So yeah, just sometimes it's. I mean, we've all done it. We just get caught up in work too much, and we take a lot on. We got family, we got kids, we got all these responsibilities, and sometimes you got to kind of take a step back and think, right, what can I do to look after myself? And that's going to modulate the nervous system, which is going to help with your back pain.
I'm definitely going to download the book, Why We Sleep. I'm definitely going to download that book, Why We Sleep, and I'm definitely going to download it for another reasons because Ben, you got all these books behind you, but I am certain you're someone who's read these books. So that's a message I got today.
Yeah, I mean, I don't profess to be I don't have any investment in Matthew Walker's books or whatever, but I feel like I should. There must be at least 10 people that have picked it up off the back of my
I think
reading.
about 500 people will purchase this now that you recommended it. So
I need to Matthew Walker know. I did tweet him, but he didn't tweet me.
Excellent. Sam, sorry, Sam, you're going to say something there.
Yeah, I was going to say, me and Ben were speaking the other day, and we were saying, why do dentists have such a high risk of getting back pain, neck pain, and all these other pains? We've already said that it's not to do with posture and things. So we were saying that the one thing that dentists have that most other professions don't have is the amount of stress that we're under. And I think a lot of dentists work alone, which, and at the moment, I think it is changing where dentists are talking to each other a lot more. And it's great that, like, in foundation year, you every week you're with colleagues and you speak about different things that go on. And I think that's probably the most important thing to prevent back pain and general well-being, is to listen to things like Headspace, Calm, to even meditate and just try and stay stress-free that way. But another way is keeping really social and joining things. I think you've gone on quite a few times about dental tubules, which I think is really good, and connecting people and going to as many conferences and courses as possible so that you can interact with different dentists, so that you know that you're not alone when you get your first complaint letter, or when that dreaded GDC letter comes through your door, or if it ever comes through your door.
It's so true, man. I was on, I know Ben had listened to episode 11, Communicating with Bruxes, but Barry Alton, he also does communication courses for dentists. And when I went on this course, I learned that 17%, according to a survey, of dentists had considered taking their life at one stage. So that just reflects, it's crazy, Ben. I mean, it just reflects the stress that we do have in our profession. But I think you two, the way you've covered it today, have debunked a lot of myths that are out there, which really, really shocked me, honestly. And I've learned so much from that. Is there any final comments you'd like to add?
You first, Sam.
Yeah, so, well, we really want to promote kind of self-help and strategies for dentists. And me and Ben at the moment are currently putting forward something called the Tooth Physio, which is on Twitter and Instagram at the moment. And we're thinking, or we're going to see whether we can try and put a course together as well, where we can go through case studies and go through exercises and different things like that can help, specifically aimed at dentists, to help dentists. But I think the main things to take away from today would be that the back is really, really strong. Tons of muscles, ligaments, fascia that protect it. The reason why it's painful won't be to do with posture. It'll be because of other psychosocial factors that are going on in your life as well. And that if you are in pain, that the road to recovery is never a positive correlation. It's always got pitfalls and things. But if you are in any worry about your back pain, the best thing to do is to seek help from, like Ben said, an evidence-based healthcare professional, and to go from it that way. And they'll be able to give you self-management strategies and help to manage the pain, get you back to activity faster. And they'll give you a paced exercise program that you can work with to get you back to activity and get you back working as well. That would be the messages I'd give.
Can I just intervene, Ben, before you go? Is that on the last episode that I just published the other day, one of my pearls I shared was to go on the ACP TMD website, which is the chartered sort of physiotherapists in TMD. So those physiotherapists who have got a special interest in TMD. And I found that really helpful to connect with my local physiotherapist who has done further training in TMD. And I had lunch with him and I learned some stuff from him. Where can a dentist go if they want to find a physio like you, who's obviously evidence-based and cares very much to give up an evening to come on a podcast like this? Where can we find, obviously I'll put your contact details for those in London, but if someone somewhere, is there like an association that you think are a bit more clued on than others?
Yeah, I would say if your area is under Connect Health, who I work for, then you definitely get an evidence-based care there. If you feel like you're not, I think, as I say, see if you can find, if you go on Twitter and you go to MSK Reform, there'll be a bunch of physios on there that are in high regard. They will, I guarantee you, they'll be able to recommend a good evidence-based physio locally for you. And anyone that follows hashtag the big R's, which is also part of that movement. So anything like that. And I suppose, I mean, there's obviously thousands of really good evidence-based NHS physios on there. So I think you probably see if you can go for MSKR, MSK Reform. But yeah, if not,
I'll put your details in there for anyone in London, and I'll put your guys' physio.
My Twitter handle is @Ben_Phys. Phys is spelled capital F, capital Y, capital S. Ben, there was a lot of Ben physios, as you can probably imagine. So it was like Phys, that'll do.
Yeah. I like it.
Nice.
Guys, thank you so much for giving up your evening to come and teaching us so much. One thing I have to mention before we go, though, is to do with you, Sam, is that it's interesting how you said how having the loops or the scope because of the change of posture will not necessarily mean that you have a better back. But I love the fact that you still have loops because we both value the importance of magnification in dentistry, right? I mean, I don't want people to get the wrong message here and think, actually, no, people who are on the cusp who are about to purchase magnification, they should not then be put off by what you said. They should still go ahead and buy the loops.
Oh, 100%. Yeah. And I use loops not because it helps my back pain, but just because you get the magnification. The systematic review that didn't say anything about it helping back pain, said that it does 100% improve your dentistry. And also the light, if you do get it with a light, the light's about 4 times stronger than the headlight. I use the headlight now and I can't see a thing when I'm looking at the tooth. Whereas I put my light on and it's literally like it. I feel like doing. Me and Ben were speaking the other day, and he said that dentistry is like. It was on one of your podcasts when you talk when somebody was talking about it's like working through a letterbox in the dark. Well, why don't you work through a letterbox with the light on?
Absolutely, but I'm just hoping to go through one episode with someone without having to mention a gem from that episode 10, Zach. That was Zach Cara's episode. Every bloody episode we're having to refer back to that one episode. So Zach, I know you listen to this. Bloody good you are. One more thing I forgot to ask, which I can just cut in, is foam rollers, yay or nay?
So nice. So if it feels nice, absolutely. I mean, I like a bit of foam rolling, to be fair. But that's what you're doing it for. It's because it feels nice. It's gonna give you that short-term relief, just like the massage. It's not gonna change the health of your tissues.
And we were saying that good, like pain relieving strategies as well, or what me and Ben used to do, but it does still really help. Say if you're a dentist and you do have some back pain, is getting, say, a hot water bottle on it for 20 minutes, to use a tennis ball against the wall and kind of rub around the back. That can really help to relieve off that acute pain. But it won't help to get you better, but it will help to reduce the pain. The only thing that will get you better is the exercise and the progressive exercise that you do. But
I have never moved so much while recording a podcast because you guys.
with ice and heat, so interestingly, like again, it doesn't change the tissues below. you're a mammal, so it doesn't matter whether you're in Antarctica or in the Sahara. You're going to maintain an internal homeostasis no matter what. So you're doing it for that pain, that different sensation, and some people prefer heat, some people prefer ice. Ice basically reduces the neuron firing, so that's why it's less painful. It doesn't reduce inflammation and swelling, because it doesn't. For it to do that, it'd have to be like your skin would have to, well, your tissues would have to be like 27 degrees, and there is no way you're going to get your tissues below the skin to 27 degrees with ice. It's just not going to get through. So that's another myth with ice and heat as well.
Unless Rose doesn't let you on the door.
That's true. You got to get a Titanic reference in there if you can. So Jazz, you were talking about parallels, right? So I had a little dive into your podcast, right? And I expected like physio to be here and dentistry to be here, right? And I was completely, like, you were talking about stuff like communication, how important that is, like developing rapport, trust. When you're getting patients to self-manage with like brushing their teeth, flossing, changing diet, stuff like that. I mean, I'm basically an exercise salesman, right? So like I was quite amazed at how actually two different professions working in different kind of areas we're promoting the same kind of thing, being trustworthy, being honest, coming up with a shared decision with the patient, informed consent, going through their options and the risks versus benefit analysis of this, that, and the other. And I just blew me away. I just thought that actually, we're actually very much the same.
I think so. When I listened to that Physio Edge, when I also thought a bit of that. I mean, that went in depth about some physio aspects, which I didn't understand about certain techniques. But yeah, in terms of the overall themes, trying to be evidence-based and trying to, essentially it's healthcare. So yeah, it was very interesting. Yeah,
and like Zach Cara, like you say, you mentioned him. That was, some of the stuff he was mentioning. I think I took a couple of bits. I think you mentioned about a late patient, about how to address that.
How to address how the reception data. Yeah, that was a gem. Honestly, that episode is still one of the the gems. The number of gems per sentence factor is phenomenal from that one. So it's just credit to Zach. But guys, thank you so much for coming on. I'll put all your Twitter handles and Instagram handles on so people can follow the advice that you're giving. And really appreciate you coming on.
No worries, man. Have a good evening.
Thank you very much for watching all the way to the end. I really appreciate it. And if there's any other topics that you think I should cover, let me know. I've got loads of episodes sort of edited already, including complete dentures with Mark Bishop, cracked teeth with Krina Patel, composite versus ceramic with none other than legend Chris Orr. I've also got our one of the favorites, a protrusive favorite, Zach Cara, back on to discuss presenting treatment plans and communicating with patients yet again. Don't forget to hit subscribe on the YouTube. And if you also want to stay in tune with the email content that I'm sending, like recently I put a YouTube video up, how I take occlusal photos, and only those on social media would have seen it. So if you want something like that in your inbox, if you head over to protrusive.co.uk, type in your name and email, stuff like that will be coming to your inbox as well, so keep in touch. So anyway, I'll catch you in the next episode. Thank you so much for listening.